with Docs, the chronic disease reversal hub, where we offer you the community, coaching, and education that you need to help you prevent and even reverse chronic diseases such as obesity, high blood pressure, high cholesterol levels, heart disease, and of course, type 2 diabetes, and even so many autoimmune diseases that we are learning to be more and more connected to our lifestyle. My name is Dr. Linda, emergency medicine and board certified lifestyle medicine doctor here from Sheffield, UK. Now, we are here every single Sunday at 5 p.m. UK time on Zoom, as well as live streaming to YouTube and Facebook. So if you're on YouTube, please hit the subscribe button to support our work. And if you would like to share this evidence-based lifestyle medicine message, please go ahead and help others heal as well. Today, we have an incredible conversation with Dr. Jyothi Rao, and we are going to be discussing Body on Fire cookbook. And Dr. Rao has been practicing internal medicine for over 25 years. She's certified in acupuncture for 20 years and uses it in her practice as part of a toolkit to heal patients. She's a firm believer in partnership with patients and is active in her community in running educational seminars on lifestyle medicine. She is part of the educational staff at George Washington University and Maryland University of Integrative Medicine and Institute for Integrative Nutrition, where she teaches healthcare providers about topics such as wellness, acupuncture, lab interpretation, and the role of lifestyle choices in maintaining health. Her book, Body on Fire, was written to empower patients and providers with tools on healing and prevention of chronic illness. The cookbook is an additional resource to stress the importance of macro and micronutrients, the microbiome, and the role food plays in inflammation. Thank you so much, Dr. Rao, for joining us today on this Sunday and taking up your time to educate us and bring healing to the community.
Thank you very much for having me. I'm very excited to be here.
I would love to, with the incredible medical experience that you have, I would love to set the scene for our listeners by asking you what kind of patients have you been treating and what kind of miracles you have been seeing in your clinical practice?
Yeah, I'm such a wonderful experience since I have changed the way I practiced about 15 years ago, incorporating more integrative approach as opposed to using just meds and supplements or meds and surgery and physical therapy. Those are all valuable. I'm not saying they're bad, but it became quite, within 2-3 years, I was very disillusioned with medicine, feeling like we're just kind of putting out fires for people. And then my journey began with acupuncture, where I found that true healing, where you could speak to, I wasn't completely understanding how a few needles in someone treating something like carpal tunnel could make them feel less tired, and the energy of kind of focusing on just not one thing, but like the whole body's connected type of a concept. So that began my journey into looking at the gut. So I began with the gut, and now I know, based on the sympathetic parasympathetic system and the autonomic nervous system, which is there to help us, we are often on what's called sympathetic overdrive, which means our fight or flight are all burning up. They're just driving all the time from stress and fear and anxiety and whatever it is. And we need to have our parasympathetic supported. Our parasympathetic system is our rest and our digest system. And so that concept for me was life altering. How you can feed the parasympathetic system, even if you didn't change the environment that you were in. If you just fed that parasympathetic system, you recharged your battery and you gave your body the power to heal. And what does that mean? What that means is the digest part includes the gut microbiome, and I'm sure we'll speak about that. But at the time, 15 years ago, we didn't have a ton of information on microbiome. But what I did know was when I put a needle in someone, regardless of what it was helping their vagus nerve, which innervates that parasympathetic system. And they were getting healing qualities of restorative sleep, just calming down their anxiety, feeling so peaceful. And that allowed them to make better choices. So my journey began with the gut. And so when I found out about the concept of an elimination diet, which was eliminating the 8 most inflammatory foods, that was beef, eggs, gluten, dairy, soy, corn, peanuts, and eggs. That, I think that was it. So if I started doing that, I learned this from a pain doctor actually, who said every Monday he would have more calls for people in pain because they went out in the weekend and they ate differently. So he started that concept of the elimination diet, and the pain patterns of people started to change. And I started using that because it was simple. I would hand them a sheet, eliminate this food, because at that point I was seeing 25 to 30 people a day. You didn't have much time for communication. And then I saw that within 4 weeks, 6 weeks, people started to come back to me, not only saying that their pain was better, but they were sleeping better and they were losing weight and their hormones were doing better. And I was very confused because I did not understand the connection between all of this. And I thought, oh, that's a fluke. Well, you're probably exercising more. Well, you're probably just in a better mood because you're not in pain. But no, it happened over and over again. And so then this power of, animal products versus plant-based diet. So personally speaking, my journey has been always about not being tired. I didn't have a full medical problem, but my life was packed, as most people's are. And I didn't want to slow down for low energy. And so I would, one day I forgot to go to the grocery store and I didn't have any cheese or milk or yogurt that I would do in between patients because I really had time to eat. I wasn't tired. And a week went by and my allergies went away. And I said, why am I not sneezing? Why am I not having allergies? So it was confusing to me, but my journey has also been personal. I gained more energy. And then when your gut microbiome changes, of course, as we know, lots of things start to change. So that's that parasympathetic rest and digest. So you work on the digestion, you work on food, you work on the microbiome. And then the rest part is huge. That is really what I'm passionate about as well. Mind-body connections, restorative sleep. Because when you rest better, you digest better. And when you digest better, you rest better. So they're completely linked through that vagus nerve. So in my practice, we do a lot of vagal nerve work. And so in the journey that I have with these miracles, it's been removing these offending foods, inflammatory foods, watching people, hormones get better, endometriosis gets better, pain patterns get better, weight loss happens, but that is not the goal, right? The goal isn't weight loss. The goal is reduce the inflammation in your body and your metabolism starts to come back, or your gut microbiome, which is in charge of our metabolism as well, starts to react properly to the foods that we're eating. So I have many examples of things, but a lot of it started with that journey of eliminating and adding back. And then so now, of course, we talk about the microbiome a lot. What feeds our good bugs? What grows our bad bugs? Are we digesting our food? Simple concepts of heartburn, for example. Most people are, typing and drinking and eating, and they're running in the car and they're having dinner on the way. They're basically telling their body, I'm running from a tiger, sympathetic overdrive, rest and digest shuts down. Bad bugs grow. We don't digest our food. This whole cycle keeps going. So mindful eating is also what I found to be completely amazing, just to tell people to slow down and chew and eat. Heartburn starts to go away, indigestion starts to get better. If you start to fix the systems, your microbiome starts to change, right? So I'm struggling with lowering of lipids. I just had a patient this week, 50% reduction in her lipids, 50%, so hard to do. You can't do that with the medication. So, sugar control, insulin resistance going away, polycystic ovaries going away, people getting pregnant, so fabulous, right? Infertility because of insulin resistance. It's not miracle every time. It's work and it's hard work, and it can take 3, 6 months up to a year. So it's a journey that people have. And I don't want to, say that it's, some sort of thing that happens in 6 weeks, but it is a path to wellness and health. Obviously, autoimmune disease changing is also a very big thing that we see. Not completely back to zero, but sometimes enough so that people can work as they were disabled with their pain, but their pain is much more controlled. I have someone who had chronic iritis who was on prednisone drops, went to a plant-based diet. She was able to get off the prednisone drops in her eye, which has been on for 6 months. I mean, amazing stories over and over again, right? So it's hard not to, and honestly, every time it happens, I'm like, really? Because there's a part of me that's just like, it's a miracle. It's just a miracle that just happened. So I feel very excited about it. And So it's lovely to see. I hope I answered your question. I know I went on a bunch of tangents.
No, it's incredible how passionate you are in about the subject. Just like me, I have gone through exactly the same changes of going off of dairy meat when I was looking at my colitis. And just like you, I was super surprised. What's going on? I can get off of the drugs. I'm losing weight, and I'm not doing anything except just eliminating these toxic foods from my everyday diet consciously. And you mentioned chronic diseases. Could we define for our listeners what are chronic diseases, and see if they actually fall into this category?
Sure. So chronic disease for me is basically, there's symptoms and then there's illness. So hypertension, heart disease, diabetes, chronic pain is actually a disease, whether it's, neck pain, abdominal pain, autoimmune disease, cancers, so polycystic ovaries, metabolic syndrome, so many chronic medical problems. Basically, the symptoms, I just want to step back for a second because the symptoms are not, you don't get disease overnight. It's something that's established for, say, 3 months. I want to include mental health as well, anxiety, depression, obsessive compulsive. These are also chronic illnesses. Usually we say about 3 months. If you've had something ongoing, we start medications depending on the urgencies at the 3-month mark. For me, also, even though I do lifestyle, I don't like to sit on high blood pressure for more than 3 months if we can't make a difference in it. I don't like to sit on diabetes. I don't like to sit on cholesterol, but I give people about 3 months to try lifestyle, because if I add medicines too quickly, they don't understand the power of their lifestyle choices. So anyways, that's kind of the way I practice. But if for mental health and all of these other things, the symptoms, you don't wake up one day with diabetes. You wake up maybe 5, 10, memory loss, for example, Alzheimer's is chronic illness, but memory loss can start at 40. You can develop Alzheimer's at 60. But that mild cognitive impairment started 20 years ago, as do most illnesses. The symptoms and signs are there, and they could start with bloating. They could start with gas and rumbling, heartburn, indigestion. Fast forward 10 years, you have a colitis. But not everybody will have that. I don't want to scare anyone, but my point is, listen to your body. The signs are coming. It's like these lights that come on in your car that say oil change, oil change, oil change. We do not Band-Aid that. We don't drive and then just Band-Aid that oil change sign, but we do that to ourselves all the time. Our body's saying, I'm tired, your hair's falling out, you're not able to lose the weight. Listen to me, there's something going on that's wrong, but we just keep plugging away and we don't change things. And these are symptoms of things that can lead to chronic illness. So first it starts with awareness of, you don't have to feel this way. I have so many people who go to Hopkins. Johns Hopkins is very close to me. And they come back and they're 40 or they're 45 and they say, I don't know what's wrong with me. I think it's my thyroid. I'm so tired all the time. And Hopkins looks at them and says things like, well, what do you expect? You're 40. You're supposed to be tired. You're supposed to be gaining weight. Your metabolism's slowing down. I don't accept that. I'm sure Dr. Linda doesn't accept that. Age is a number. You don't magically just stop functioning at 40. Hormones change, but you can absolutely be optimal for a very long time. The blue zone diets have told us that. So we really want to empower people to say, don't accept this feeling. Figure out what's wrong before it turns into an illness, right? What do we do for cancers now? We screen after the cancer has started. We screen for mammograms to detect the breast cancer. We don't want to give the body the tools to make the cancer. Don't create the inflammation. Create the body optimally so that you don't make the cells that make the breast cancer. Right. So, again, it's not anybody's fault that they get it. But what I'm saying is you can look back to symptoms and start changing before you get the illness.
And I think the important message here is that you have those symptoms, you can listen to your body. But what happens when you come to current way of practicing medicine, when we meet you as doctors and we don't find anything in your blood tests, we don't find anything on your x-rays or your MRIs or CT scans, and we just discharge you saying that nothing is wrong, because this inflammation that is riding in the background due to our lifestyle, what we eat, the processed foods, the lack of sleep, this economical drive, it's burning inside. As you said, your body is on fire, but unfortunately we are unable to pick up on that very early on. And the fact that we tell you that it's there's nothing wrong with you, we have to now start challenging this, isn't it? So we have to empower our patients to say, yes, you can do something about it. And yes, sometimes it isn't right what we are telling you. If you feel that something is wrong, then have a look at your lifestyle, like we will be discussing today. Have a look at your sleep patterns, your exercise, and your diet. And of course, the stress levels where they come in. And we'll talk more about that. Is that right, Dr. Rao?
Absolutely. And I never want to leave a patient with no guidance saying, there's nothing I can do. It's the worst thing you can say to someone. I feel like there's always something you can give, a tool for someone to help them along a journey. It is not that every single patient of mine gets off all their medications, but we do make a dent in the dosing and the quantity. A lot of times, you can make dents in the dosing of a medicine. You can make a dent in, I don't take 3 meds for hypertension. I'm just on 1 now. It's change that we want, and we want you to feel good in the process. Sometimes these meds, you can fix the cholesterol, but your brain's still foggy and you're still tired and you don't feel like yourself and you're still sad. And, that's not what we want from the medicine. We want it to be putting out the dangers of having a coronary artery, event, or having a stroke or things like that. I use meds and even supplements to kind of bridge to the lifestyle that we want. But we need time for lifestyle often, and we want to keep you safe. So I use meds to keep people safe. And while we're encouraging people, so many people, we give all these talks in these plant-based groups, which are lovely. But so many people come up to me saying, I eat a perfect diet. I can't lose weight. I eat a perfect diet. I don't know why I'm so tired all the time. Well, it's part of it, but it's also, we have to look at the other parts of it, the rest and digest. Are you sleeping? No, I sleep 4 hours a day. I'm so stressed out. I have all of these other things. I'm a caregiver. I have a child that I take care of. These stressors matter. And I don't want people to minimize them, because a lot of times people say, what's wrong with me? Why can't I handle this? And I used to do that to myself. What's wrong with me? Why am I so tired? Why am I such a loser? I would say this to myself because you don't know what just changed, but you try these things one at a time. And that's what Body on Fire, the book, did, which we followed up with the cookbook, because one of the feedbacks we got from the original text was there's so many things. Where do I start? Where do I start? What would I start with? Exercise? Do I start with, do I start with my meditation? We always start with food? I think that's pretty safe to say. But if your diet is very good and you're eating well, then maybe you try fasting. Maybe you try, eating in less often and less hours of the day, so that your liver and your microbiome start changing. So it's very personalized, but I do think that one thing that's missing for a lot of us is there's too much of things. There's too much noise. There's not enough quiet. There's not enough, it's almost a badge of honor not to sleep. You almost feel lazy saying I sleep 7 hours a day. The point is that, yes, diet is very, very important, but it's not everything. And we need to look at that rest part as well. And so that is a very fundamental belief I have for medicine, because in internal medicine, I think I see the consequences of stress, like what happened to you in med school and residency. I think that the stress plays a gigantic role in the declaration of an illness, right? So we have to give people tools. It's not that if you came into me with a chest pain, I'm going to wave a wand over you and say, meditate. We're going to do the things. And that's what medicine's good for, putting out fires, helping people acutely, with cancer treatments and heart attacks. And it's amazing. We can save lives that way. But again, you didn't wake up one day and showed up with heart disease. It's been brewing. You can see it on the lab. Your fasting sugar says, 80, then it goes to 85, then it goes to 90, then it goes to 95, and then it's 100, still normal. But your body's telling you, I'm not processing these sugars. If you do nothing, 3 years from now, I'm going to have diabetes. We're going to have diabetes. So, these are signs and symptoms.
Let's have a look at when we break down chronic disease just a little bit. When we look at type 2 diabetes and insulin resistance, when do we start seeing these symptoms in our patients, including fatty liver disease? And when do you think we can start addressing this problem?
My personal practice has been, my goal for people is to be 85 or lower for fasting sugar, and I test fasting insulin as well. I try to keep that insulin about 8 to 10, fasting insulin. I have recently been checking 2 hours postprandial insulin, because that's where you catch the people that have the high hemoglobin A1Cs or pre-diabetes or diabetes. That's the marker we use that looks at sugar control over 3 months. but their fasting sugar is 80 or 85. And you're saying, well, what's going on with them? Why do they have diabetes? They're fast. It's just one marker. But when those patients, what I find is when they eat something, their pancreas is working really hard. Their receptors are not effective. So they pump out insulin, and it's not getting the sugar into the cells. And that insulin resistance shows up as an insulin of 80 2 hours after they eat. And I try to screen people that way. So most everybody in my practice gets a C-reactive protein for inflammation. They get a hemoglobin A1C. They get a insulin fasting, if not also a 2-hour postprandial, so I can catch those. And I start working on it early on, not necessarily saying I'm treating you for diabetes, but if you're treating people for inflammation, you are going to want to, for example, add fiber. Everybody should add fiber. Reduce your saturated fats and reduce those refined sugars. So early on, those are the markers that I do. And also increase waist circumference. Ideally, some data that shows that your waist circumference in inches should be half of your height. And that's ideal. Now it's really hard. I mean, that's a challenging number, but once you start to see that abdomen getting bigger and bigger and bigger, that's insulin resistance until proven otherwise to me. So, I mean, we need to work on that.
And while we're covering type 2 diabetes, in your book, you really nicely highlighted that type 1 diabetes can be the result of the inflammation autoimmune response due to the leaky gut. Could we talk a little bit about the pancreas and this phenomenon?
Sure. So there's very many people that are born who are genetically predisposed to type 1 diabetes, which presents with a lack of insulin cells. The pancreas is cells which make the insulin are getting attacked with the immune cells that the response. But now we're seeing LADA, which is late onset diabetes as well, based on autoimmune cells that attack the pancreas. So that can happen in an adult post-virus for many reasons, extreme stress. But whenever I see autoimmune disease, I always go back to the gut. The gut is where 80% of our immune cells are. And those cells are the ones that are communicating to the body self or non-self. And that, our immune system's there to protect us from foreign things, bacteria, cancer cells, things but it's also there to help us heal from, say, a wound, a cut. So it is a very, very, very fine system that's got multiple players in it, but sometimes it gets confused on what's self and what's not self. And my perception is that it's based on, digesting if you're not digesting your food, sometimes that looks like a foreign body because the food's not being digested, or you have bad bugs. So bacterial overgrowth can create a phenomenon where you are getting predisposed to, say, ulcerative colitis or Crohn's because the bacteria is changing in the gut. Bacteria create these endotoxins, which are toxins that can directly insult the gut and increase permeability to leaky gut or intestinal permeability. That phenomenon, I believe, is associated with autoimmune issues. What do you do about that? You change the gut microbiome. You change the diet. You get away from the inflammatory foods. Now, not everybody is going to get type 1 diabetes reversed. It is a challenging situation if you're born with it or you get it at a young age. But we have seen, and I have seen, late onset diabetes, insulin dependent, get better significantly with lifestyle changes. So I would say for most people, you may not be able to get off your insulin, but you may be able to reduce the dose. And overall, you may be able to just feel quality better because insulin also promotes fat. So if you have very high doses of insulin, sometimes you're not able to lose weight. Very commonly seen that. The answer isn't get off your insulin. The answer is add lifestyle changes, promote sleep, maybe incorporate exercise in different ways. We can talk a lot about a lot of things, but and then make sure your mind-body connection is good. Lower that inflammation by concentrating on, positivity, but also meditating and those kind of things. It makes a difference.
But very often you do see in type 2 diabetes that they are within 3 months, we can significantly reduce the HCA1, but as well as not reverse, but put diabetes into remission.
Absolutely. So sorry, I was just talking about type 1, which is challenging, but type 2, completely different ballgame. That one I have, my goal is to get that reversed. And so that is absolutely possible with Dr. Barnard has written books about reversing diabetes. It's not just about the animal products, it's also about, it's not the sugar, it's the fats. He talks about the fats being, clogging up the insulin receptor. Also a new concept for me. I hadn't heard that before, but when you employ these techniques, you see change. So if you just get people off of refined carbs, but they're still eating, their butters and and lots of oils and fats, it's very challenging to reverse the diabetes. You have to also remove the fats. And I think you have to go to a whole food plant-based diet, right? So we both know that you can be a bad vegetarian or a bad vegan. It's not about the term. It's about whole foods that contain all the nutrients and the fiber. Fiber is so key with most of these issues.
That's exactly what I have been saying with my patients as well. Within 3 months after suffering from type 2 diabetes, high blood pressure, high cholesterol, cardiovascular disease, in 3 months, this cholesterol is plummeting. Type 2 diabetes is being reversed, and we do think it's like magic, but actually it's just the normal way our body responds to good lifestyle that is outside of our Western practices. I would like to move on to cardiovascular disease for those who are hoping to address their hypertension and high cholesterol, but as well as prevent that deadly heart attack for themselves and for their loved ones. How could we cover that?
Yes, one more second about the insulin. I just wanted to mention that insulin resistance is also a very big problem in internal medicine issues, because it creates that weight in the belly, which then increases that visceral fat, the fat that's surrounding the organs, which then becomes inflammatory. It becomes its own organ and creates tons of inflammation in the body, which also can cause metabolic syndrome and polycystic ovaries, infertility. But the big one that we are finding now is Alzheimer's. So insulin resistance can be directly linked to Alzheimer's. So we don't want to minimize the sugar issue. Even if you don't have diabetes, there are multiple medical problems that we see that are related to insulin resistance and waist circumference. So that's just one thing I wanted to say about that. So with cholesterol and with the heart disease, hypertension, so, it is very important for me to, tell people they must work with their provider, because there are numbers in both medicine, in both blood pressure and lipids and markers of inflammation and family history that absolutely warrant medications. So really, I think people should understand that cardiovascular disease is still the number one reason people are dying. And so we need to be aggressive about it, but we also need to be smart. So diet absolutely makes a difference in lowering the blood pressure, because you're lowering that sympathetic overdrive, right? So one is that when you have a sympathetic system fight or flight response in your body, heart rate goes up, blood pressure goes up, because your adrenaline goes up. And so adrenaline drives those blood vessels to constrict, and blood vessels constricting drives up your blood pressure, and it starts to affect the cells, the endothelium, the cells that line the blood vessels. They're very, very upset by the sympathetic overdrive. So one thing with blood pressure issues and cardiovascular is really work on that parasympathetic, that vagal tone, because the vagus slows down the heart rate, lowers the blood pressure, and lowers cortisol. It also helps the endothelium. So one big thing is to work on mind body. The second thing is obviously diet. Get rid of inflammatory foods, add back lots of fiber. But in cardiovascular disease, you also want to talk about, and all of these things, antioxidants, anti-inflammatory, so bright colors. Eat the rainbow. Don't always eat greens. I have to make this point for my patients, because I'm a big smoothie fan. I love smoothies. I think it's a great way for people to get fiber in their diet and variety. But you want to just not eat greens. Greens are very highly touted. They're wonderful, but there's other beautiful colors, purples and oranges and reds, that are also equally important. So when you eat the rainbow, you're going to get the lycopene for the cardiovascular. You're going to get the beta carotene, through the oranges and the greens. And so you want to be very comprehensive and eat the rainbow, so that you can get your body these nutrients that the blood vessels really need. But at the same time, remember, sleep. If you sleep badly, you wake up with higher sugar and higher blood pressure and higher cortisol. So anybody who has high cardiovascular issues absolutely needs to go back to sleep and see how they're sleeping restoratively or not, and work on that. Sleep apnea is very underdiagnosed. That is a very big blood constrictor when you're not oxygenating at night. And a lot of people suffer from it, but they say, I don't want to wear a mask, so I'm not going to go check, but please check and please fix it. Yes, weight loss actually works to get rid of it, but your gut microbiome is actually more resistant to the change, and it actually slows down the ability for your weight loss if you have sleep apnea. So you might need that CPAP to bridge you to lose the weight so that you get off the CPAP. You know what I mean? So some of these things we have to do so that we can come back to lifestyle. But yeah, sorry. And the last thing I'll say is the nitric oxide. Nitric oxide is a gas that dilates our blood vessels, and it's found in abundance in green leafy vegetables. Kale is off the charts, bok choy, arugula, these are wonderful foods, even beets. And I encourage all my cardiovascular patients to kind of follow that plan of incorporating those into their diets so that nitric oxide can be released. The other way released nitric oxide is exercise. So rapid movements, exercise and when you have muscle fatigue, your nitric oxide is released to open up the blood vessels to get more blood flow to the muscles. So we want to do a sustained level of exercise. And there's a doctor named Zach Bush. I don't know if you know him. He has a 4-minute exercise routine to release nitric oxide, and he's wonderful. You can find him on YouTube. And I tell my patients, he has variations for shoulder issues and things like that, but it's a nice way to also work for nitric oxide. So you can get it through diet, you can get it through restorative sleep, you can get it through lowering your mind body, but also adding movement.
It's good to know also that you only need to do 4 minutes at least every single day to already start making a difference. It really doesn't matter, even if it's just 1 minute. I think it's very important just to get up and do something if you've never done anything before, right?
Yes, I think the issue is sit less. That is the basic fundamental concept. Sit less, you're standing. Yeah. I know. I sit in my office, I sit on an exercise ball, which I think is really helpful. And then in between.
It made a huge difference for my mental health as well, while working many, many hours in A&E in emergency medicine, whilst we are moving about a lot. When I do my paperwork, I did notice the claustrophobia when we are sitting down, and it also prevents you to get that extra glass of water, or stretching out in a chair is really very difficult. So making this change not long ago have really improved everything.
Yeah, no, I found it very confusing to me why I would be so tired, say, sitting in traffic. Why am I so tired? I'd be exhausted getting out of the car. And it just doesn't make any sense. Or sitting all day in a Zoom calls. I much prefer patients in the office because then I'm moving more. But sometimes my days are full of just virtual visits and I get so tired. I don't know why that is. It's so silly. So now I started doing yoga movements in between Zoom calls so that I can wake up.
Yeah, and it's also very good to show that you can lead by example and maybe walk and talk very often. Yes. It's very helpful for those who are all the time on the phone. But I would love to cover a little bit about autoimmune disease as well, as Dr. Agarwal has done such an amazing job with hers. If we could just address how and what type of autoimmune diseases are we addressing with lifestyle?
So I think it's critical to understand that, the gut-brain connection is real. And like I said, immune system, 80% is in the gut. So we really need to speak to the gut in terms of changing that microbiome. Microbiome is directly linked to this process of, endotoxemia, which are toxins that are released from the capsules, LPS, that can injure the lining of the gut. So when that lining gets injured, you're telling signals to the immune system that there's a foreigner around. You could mix up the signals for your own food. Say your asparagus now becomes your enemy. We do a lot with food allergy testing and food sensitivity testing in my practice, because foods are triggers in the short term for the gut to be inflamed and for the gut to release more products against it. For example, like thyroid. Hashimoto's thyroiditis, there's in my patients who have that, I will get rid of gluten, dairy, and corn, at least in the beginning. So because some of their antibodies cross-react with the thyroid antibody. And by simply doing that, we've seen some of their antibodies levels go down. That doesn't mean they're cured. And my goal isn't to keep them off of it long-term. It's about trying to, again, calm down that inflammation so that they can incorporate those other techniques like sleep and movement and all those things. So then over time, their gut microbiome changes, which means that they may be able to add those foods back. So for me, the intolerance to foods sometimes is that the gut, you're walking around with a bad gut. And so in terms of the bugs, And once those bugs change, for example, you can have beans again, and you can have, this concept of lectins, is highly touted as an avoidance in autoimmune world. Some of the talk is about avoid lectins, which are in some of the best foods that we have, like beans and legumes. And I think it's completely misrepresented because it's the lectins. And just because you have gas and bloating doesn't mean your body's creating antibodies to that food. It basically means that your gut microbiome at this moment that you're eating it cannot process this. And over time, you can teach the gut microbiome by changing it to tolerate these foods, because these foods, are not poisonous unless you eat raw kidney beans, which nobody does. If you cook beans, if you soak them overnight, if you stew them, and if you sprout things like mung and those kind of things, you can actually get rid of the lectins. So they're not bad for you. In fact, these are the foods that show the best data in longevity. In the blue zone data, most of these places ate beans and legumes. So it's very hard for me to comprehend, but a lot of my autoimmune patients come in and say, well, I can't have nightshades, and I can't have legumes, and I can't have this, and I can't have that. And I say, well, okay, we're going to see where you are today. And then over time, we're going to try to introduce things back, because the goal is a diverse microbiome. Each food grows one bug. So a kale, raw kale, grows one type of bug. Cooked kale grows one type of bug. And the overall game to prevent chronic illness is to have the most amount of bugs you can have. All sorts of bugs, 1,500 colonies, 3,000 colonies, all better than 500 colonies. If we only eat 3 or 5 things or 20 things in a week, we're only going to grow those bugs. So really, we need to diversify. And I tell people that, try to shoot for 35 different things in a week, plants. It's a tall order. You have to be intentional about it. When you go to the grocery store, we all do this, get the same stuff every week, right? Cook the same, even in our smoothies, same stuff goes in. Try to vary it. Try to vary your seeds, try to vary the colors, try to vary the berries, try to vary the greens, try to cook it differently. Have raw kale, have cooked kale, cut your onions up and choose some raw onions while you're doing it, and cook the rest. Everything matters. It is really a wonderful way to kind of diversify, and adding spices is wonderful too. That also are plants, they're plants. So spices add a bunch of flavor. They take away from the salt intake that you might have to raise your blood pressure. That was actually the reason I got into food in the first place. The patient's wife had come in, and he was 30 and he had high blood pressure. And she said, I know he's not supposed to have salt, but what am I going to put in the food to help him eat it? I had no answers. I didn't know anything at the time about food and spices and cooking. That's when I started my journey of trying to find food alternatives to salt for my cardiovascular patients. And that's part of why we write about spices a lot. Spices are a wonderful way to give back taste, but also, get away from the excessive salt we're using.
Which autoimmune diseases in your personal clinical practice have you noticed the best response to lifestyle changes?
So different types of arthritis, psoriatic arthritis, rheumatoid arthritis, gut ones also as well, like different types of colitis, ulcerative, Crohn's, thyroid, Hashimoto's. I have a lot of patients with thyroid illness. And so dietary interventions do make a big difference with the thyroiditis that people see. I'm trying to see, I have a handful of patients with, say, MS, a little bit more challenging with that. But yeah, big spectrum of different autoimmune, and everybody's response is very different. So, that's the hard part, is that it's the same diagnosis, but the therapies oftentimes are different for people in terms of trying. Sometimes it's the dairy for one person, other times it's, adding back more greens or fixing the sleep, all of these things matter. They all speak to the immune system. So that's why I find it really important to do the more integrative approach.
Yes, definitely. Everybody is an individual with their genetics. And could we touch a little bit about epigenetics in this case?
Yes, absolutely. So, we have multiple issues where people are coming in with genes, and there's very few, you're born with genes. Yeah, those are your given blueprint. But epigenetics is the concept of how we can turn on those genes and off the genes based on lifestyle, which is incredible, right? Because for my whole medical school career, we learned about genetic predispositions and blah, blah, blah. And, family history is so important and all that. And it is, because there are certain types of illnesses in cancer and, say, even in Alzheimer's and even in heart disease and lipids there is a higher risk for predisposition that you're going to get something. But you can turn on and off those genes with the gut microbiome. Gut microbiome does a big job. Our lifestyle does a big job in turning on and off those genes. So inflammation can turn on and off that genes. A virus, my father had late onset type 1 diabetes from a viral infection. So viruses, stressors, medications sometimes trigger things on for people. There's some talk about vaccines, we don't know yet, but there are lots of immune signals that can turn on and off these genes that we're born with, which is very exciting because you are in control of the destiny. And typically the things that we're recommending, like restorative sleep, like movement, like plant-based diet, they're not ever going to turn things on. They're always going to, lower the inflammation and help with keeping those genes at bay.
Just before we move on to the microbiome a little bit more in detail and gluten, what do you see around antibiotics?
So we try really hard to minimize that because there is a tremendous overuse of antibiotics for every cold. But most of my patients know that we try to do, sinus infections and upper respiratory infections. We do it through supplements like vitamin C and zinc, and I actually do acupuncture for my sinus patients. We do lymph treatments for our sinus patients to drain. We use other herbs like echinacea and other immune supporting mushrooms, for example, are wonderful. Pomegranates are wonderful. Black raspberries are wonderful to support the immune system. So we work on food. And then if it gets really bad, we do, antibiotics. But I will tell you, for skin infections, cellulitis, bladder infections that can turn into kidney infections, we use antibiotics. I just try to use it minimally. And I that each round of antibiotics changes your gut microbiome for 6 months. So we try to add back fermented foods. We try to add back probiotics. And even now I'm using something called butyrate to try to heal the cells that can, be damaged from the antibiotics. Again, everything is risk benefit, right? So we don't want people's, kidney infection to turn into a sepsis, a full-blown infection. We have to be smart. But we don't have to go back and look at why do you get so many urinary tract infections? What are we doing? So instead of just looking at putting out the fire, we also have to look at the why. And occasionally, we're allowed to have some bladder infections that can turn into kidney infections. Not everything is an immune, emergency, but it's worth thinking about. I get colds all the time. Why do you get colds all the time? These are things that tell me that their gut's not happy, their microbiome's not happy, their immune's not happy, maybe their nutrients are upset. Nutrients are another big thing that I look at. We look at nutrients, antioxidants. We look at, fat-soluble vitamins. We looked at amino acids. We look at omega-3s. We look at these things to see if people are balanced, and that sometimes can affect the immune system as well.
Let's have a look at the microbiome, the almighty, and how it's affecting our overall health, as well as the lining of our gut barrier and the leaky gut.
So the microbiome, is 100 trillion colonies, right? So it is very varied and it has multiple key players. And I think almost every 3 weeks, there's like a huge amount of information. You think you know something, but 3 weeks later, it's completely different information. So at the end, I think the point for me has been that this microbiome is the reason why those needles and the food make such a big difference. When you start someone on a diet, they come back in 4 weeks, they say, I feel so much better. And you're like, what is happening? Because those bugs they digest for us, they make our vitamins, they make our hormones, they help our metabolism. They also turn on and on the genes of inflammation. And they're supported by that vagus nerve. Again, that vagus nerve is that rest and digest. So the goal for the microbiome is to create immense diversity. And how you do that is through the food, but also through your lifestyle. If you're chronically stressed out, if you're chronically having anxiety and fearful thoughts, you're going to change that gut microbiome. If you're chronically sleep deprived, you're going to change that gut microbiome. So along with food, these other interventions also make a difference in the gut microbiome, which is why we need to focus on all of it. Because of the digestion issue, things like proton pump inhibitors, for example, are very commonly used medication, and antibiotics and NSAIDs, Motrin, Aleve, those kind of things. They change that gut microbiome. You're chasing your tail sometimes when you're on those things all the time. I always want people to talk to their doctors about the reasons they're on these meds, but that's one of the reasons why I find that the microbiome stays unbalanced if we're on these meds that continue to change it, if we're on the diet that continues to change it adversely, if we're not sleeping and we're constantly stressed out. So, food, plant-based diet, whole food diet, lots of fiber, fermented foods, all of these things are wonderful, eat the rainbow. But when people are not healing, I think we have to look at these other things that are keeping that microbiome unhappy, because they are the core of our health. A diverse microbiome with, tons of different types of colonies, say 1,500 main players, is the reason that we're going to stay well long term. It's going to reduce our chronic illness burden.
And I think for too long we have disconnected the connection between our mind and our body. And
Yes.
We have now seen that these microbiome are actually responsible for our happiness, and how they're releasing the short chain fatty acids and the butyrate. They're actually mostly responsible for the serotonin release that actually is connected with how we feel, right?
Absolutely. So the gut-brain connection is huge. It is mind-blowingly huge. It's wonderful to know that there's a two-way street between the brain and the gut. And because, when people are stressed out, I did a triathlon one time, and there's a female triathlon ones, and then there's mixed triathlons. And whenever they had the women's only triathlons, they had multiple porta potties all over the place. So many more porta potty toilets, because women tend to hold stress in their gut. So right before you get into the lake or something, there's this gigantic line of women, because we know that, the stress of starting something like that, it's funny, but it's because we have that serotonin gut connection. The funny thing about this is that our gut makes 80% of our serotonin as well, our happy juice. So we have to keep the gut happy in order to keep the brain happy, in order to keep the gut happy. So it's that constant talking back and forth, right? So we have the butyrate, for example, is the healing nutrients for healing up the cells of the gut that come from our wonderful foods that are high fiber foods that create the bacteria that make the butyrate. So butyrate, serotonin, other inflammatory markers, our cortisol, we are definitely capable of controlling the anxiety in our brain through food choices, right? And that is so fabulous, like omega-3 fatty acids, vitamin D. These are nutrients that have a really high impact on the gut-brain axis. Nutrient deficiencies, I see there's neurotransmitters need B vitamins in order to make them. Neurotransmitters are these signaling molecules that can be stimulatory, like dopamine or norepinephrine, adrenaline, or they can be calming, like GABA and taurine and glycine. And sometimes you're anxious because you have way too much adrenaline, and sometimes you're anxious because you don't have enough glycine and taurine. And so these amino acid tests that we do can help distinguish that for us and guide people on that, on what to eat and what to take as nutrients if we need to, support them.
It's fascinating. And often our patients are reluctant to start changing their lifestyle because they are facing a lot of stress at work. The anxiety is high. They're often quite depressed, and it's very difficult to start advising them to change their sleep, start running. But I find that by pressing the issue, that by adding a little bit more of the real foods, the fresh fruits and vegetables, whole grains, just supplementing their every single day diet, they start increasing their happy juice. And through that, we have a breakthrough where they are more and more keen to actually start changing, because they're, as we discussed, our energy starts going up. So with that increased energy, we have more of the desire to go think about our shopping, maybe start running. Did you find the same with your patients?
Absolutely. I think the two things that come to mind when you talk about that is, one is that so many of our foods spike insulin, whether they're, the glycemic index and things like that. So insulin, along from helping sugars get into the cell and fat promoting, it also causes fatigue. So, and, it's been associated, high levels of insulin has been associated with memory loss as well. So our brain does not do well on higher insulin levels when we eat things, that are not high in fiber. If I have, even one of those bars, if you will, the breakfast bars, or a bowl of oatmeal with the one that I do in a microwave, 2 hours later, my sugar is going to go up, my insulin is going to go up, and then I'm going to go down. And so you almost get hypoglycemic, you get irritable, you get agitated, you get angry, hangry. And so then you eat something else, which is usually whatever's in front of you, right? Because at that point, you're just irritated. And that cycle just keeps going and going and going. But if you eat whole foods, which is loaded in fiber, your sugar does this. It doesn't go like this. And, those highs and lows are also associated with mood issues. So, your lethargy or your desire not to do something could be based on the fact that your insulin's too high. And two, the second part is that your gut microbiome actually changes for the better, making those signaling molecules, making improved amounts of serotonin, right? So when you start to change those good bugs, your neurotransmitters do better. And so that also gives you the energy to take on more. So it is a beautiful, positive cycle that you see. Yeah, and you just have to start somewhere. And usually what I do is I start with getting rid of the high glycemic foods and adding back a little bit of fiber.
So let's have a look at gluten, something that is very controversial in conversations with patients as well as with our colleagues. What is your take on gluten?
So in my practice, I've had a lot of people who have been gluten sensitive, not allergic, not celiac, but because, and my idea is that their gut is right now very unhappy. And the gluten has zonulin in it, which increases intestinal permeability. So in that person who's sensitive to gluten, I do not mind people going on a gluten-free diet. It's part of that elimination diet, that eight ones, initially that lower pain. In many of my patients, it does reduce their pain level when they go off gluten. However, it is a function of the gut being unhappy. So if you do not have antibodies like celiac, if you are not born with an autoimmune issue for gluten, this is a function of having bad bugs. So then we work on clearing up the gut. We work on sleep and all the things we just talked about, adding back whole foods and getting rid of the bad foods and working on sleep and mind body. And I eventually try to reintroduce gluten. And for the thyroid patients with the TPO, I do find that their titers sometimes vary with gluten, not in everybody. But we monitor symptoms. But I do encourage people to try to add it back at a certain point, whether it's 3 months, 6 months, 1 year. And it's also the type of gluten. I find when people go to Europe, they're tolerating gluten very well. It's the American gluten that is not very well tolerated. I get this all the time from my patients. Oh, I can't eat pasta here, but I ate all the time in Rome and I was fine. So fresh quality, good produce, no preservatives. It's sometimes the preservatives in the gluten, not the gluten. Because if you start looking at labels of things, it looks like a chemistry class, right? There's so many preservatives in these gluten types of foods we eat. So that's the distinction. Is it if it's not an allergy, you might be sensitive. It might be the preservatives. It might be the type of gluten, but it also might be the fact that your gut's unhealthy. And once we heal the gut, I want you to introduce back good gluten, good versions of gluten. So for example, sourdough bread made fresh at home or at a bakery, excellent. The label only has 2 or 3 things on it. There's no preservatives. You want your bread to go bad if it's left out for 3 days, right? Or we do the frozen breads, which have high amounts of seeds, nuts, and sprouted grains. Those are also good forms of gluten. So we want to switch the discussion to what type of gluten, and also what type of where are you getting it from, and what's the story. If you feel, I have a handful of patients, maybe 10%, they just don't feel good on gluten. And as long as they're getting their grains in and their fiber in, and they're not nutritionally depleted, I don't have a problem with that as long as they're feeling well.
And let's talk a little bit about micro and macronutrients, because it's something that unfortunately in a Western diet is not in abundance. While we often say, and our patients often say that they are eating well, they very often referring to a very expensive, high meat, dairy, and fish diet. But eating well for our body from a micro and macronutrient point of view, phytonutrients and phytochemicals point of view, is not actually the case. So what are they, and how could we increase it in our lifestyle?
Sure. So the standard American diet, has very few servings of fruits and vegetables. So at the very core, we talk about fiber. So fiber is in plant-based foods, right? So if you're eating a mostly meat and potato diet with very other few vegetables and high dairy, high eggs, there are nutrients in them, but they're not as if you're eating, a bowl of salad with multiple colors. So Proteins, carbs, and fats are people also kind of confusing. And I am not a calorie counter or protein counter or any of that stuff. I don't encourage that because I think it's overwhelming and it's very stressful to kind of keep watching numbers all the time. But, carbs, there are good carbs and there's bad carbs. So specifically vegetables, whole grains, beans and legumes and nuts, they have carbs, and fruits and vegetables, but we do not want to in any sense eliminate them because they are the ones that actually grow the good bugs. And if we say that the end game is to grow a chronically diverse microbiome, and we're on a keto diet or a paleo diet that gets rid of all these carbohydrates, we might be seeing some short-term gain. Oh, I lost a little bit of weight. My this went better, that went better. But end game, we're doing ourselves a disservice because we need those good carbohydrates. Proteins, I don't know about the UK, but in America, everybody's obsessed about proteins.
Yes,
Way too much protein. Way too much protein. There's like some ridiculous amount of grams of protein, which
so
can be
much that
very
it's fueling the chronic kidneys failing.
Chronic kidney issues. It's also creating fat because if you're not keeping up with the output of eating that much protein, you're going to put on weight. And so it is detrimental to be obsessed about protein, in my opinion. And you're also taking away high protein foods, typically with the meats, don't have the fiber that we want, again, with the carbohydrates. They make you feel full, so you're going to eat less of the other good stuff. Then there's fats, right? So fats are oils, omega-3s, omega-6s. People talk about these as, omega-3s as beneficial, but the standard American diet has like 20-to-1 ratio of omega-6 to omega-3, which is very inflammatory, right? This is the processed food. These are the foods that are loaded in very dense calories. So we want to shift that game to omega-3 foods like, maybe even nuts and seeds, walnuts, chia seeds, kale, avocados. These are good oils that are coming in from and have a higher omega-3 index. And then you talk about oils, avocado oil we recommend, spraying, extra virgin olive oil or canola oil tend to be a little bit better. But in general, we say less is more. So that less oil is more, the insulin receptors do better. Your body does better. You need a little bit of oil in terms of cooking sometimes, but maybe limit it to 2 teaspoons or less per serving. We like the sprays that people use so you can get that combination. When I step back, I like the smoothie concept because you can do carbs, proteins, and fats in a smoothie. You can do the fats through nuts. You can do the berries for the carbohydrates, and greens are loaded in protein. So, you can get the proteins that way through the nuts and the greens. So you have a very comprehensive input, whether it's a meal replacement or a substitute for a breakfast, whatever it is. It's a nice way to get your fiber in as well. But the micronutrients really come from the colors and the nutrients that are densely packed in each food. So when we talk about we want to do calorie poor but nutritionally dense foods. These are things that are packed in plant-based foods. I love sprouts. Sprouts are amazing. And so they are loaded in amazing nutrients, especially things like sulforaphane in broccoli sprouts. They're very, very good for hormone balance. I see a lot of menopause, a lot of PCOS, a lot of, PMS. Sulforaphane helps the liver get rid of the estrogens that can be problematic in terms of creating these symptoms. So broccoli and broccoli sprouts and any sprouts are amazing. And you can throw them in salads, you can throw them in anything you want, sandwiches, whatever. But nuts and seeds are also there. They're packed with incredible nutrients, zinc, and vitamins that are calcium, for example, and spices, for example. These are foods that I think everyone should keep around and just throw into things. And you can create diverse environments because there's so many versions of these foods. Again, when we're trying to hit a goal of 35 different plants in a week, it's a tall order. So I have a mostly Indian diet, and I thought, easily I eat 35 different. No, I ate maybe 20 or 18 on a good week. Well, I'm trying to think about it because we're habitually prone to eating the same. We have to make an effort to throw something different. I make an effort every time I go to the grocery store to pick up something different this week than I did last week. And that's like I said, it's an intentional, it has to be intentional, it has to create an awareness that you have to do this. But macronutrients are the large things, micronutrients are the trace minerals and the vitamins that you get in foods. And this is why we want to eat the rainbow, because each color gives us different nutrients and different vitamins and minerals. And the diversity of what we eat, for example, sprouts, can create an incredible environment. It packs a big punch in a very small package. So I would encourage people to also get those nutrients in, and zinc tends to be very, very important. It's loaded in seeds.
Before we move on, I would love to ask you about the book itself, but it just came to my mind. Could we touch a little bit on lifestyle-related cancers and the evidence that we are seeing that's linking to certain types of foods, such as breast cancer, prostate, and ovarian cancer? Would love to hear your view from a scientific point of view.
Right. So the dairy issue, is big for prostate and breast, and the IGF-1 elevation with it. That's a marker that's associated with certain types of cancers. First and foremost, in those patients, I get rid of dairy because the data shows that there is some reduction in those type of cancers specifically. I did want to mention a little bit about soy. Soy has had a bad rap when it comes to breast cancer, which I feel now that we know more about soy, we know that it's not a bad player. It actually acts on receptors to prevent against breast cancers. It has to be a good version of soy. I usually recommend fermented soy, but we do not want people to stay away from soy, as we had maybe talked about 5-10 years ago, that it wasn't healthy. So removing animal products also has been shown, say, to increase fiber. Colon cancer also has a big link with increased fiber and lower colon cancer rates. But with prostate and breast, I really do think that the dairy aspect is real. And so that has been shown pretty much over and over again to be beneficial to reduce some rates.
Eliminating dairy and increasing our soya intake. What a powerful message. Would love to talk a little bit about the book, Body on Fire. I have been using it for a few months now. It's packed with incredibly simple and delicious food for somebody like myself. Again, I'm a culprit of a stressful lifestyle where I'm running to work 10-hour shifts plus minus here with the sleep. Having this easy recipes just, laid out on one page is very, very helpful for me and continuing to be so. For those who would like to address their chronic diseases and they're new to it, how should they use the book?
I would say, pick what's easy for me. So Monica, my co-author, and I, we're just like you. We run around, we're showing up at, after doing things with the kids or whatever, we show up in time to make dinner, but we don't want to be in the kitchen for 3 hours. We don't like 20 pots and pans. And I don't like to have to travel to fancy grocery stores to get my, my nutrients or my recipe items. So we've made it simple, and every one of these recipes is something we would be able to make within 30 to 40 minutes, which is, I think, reasonable when you get home from work and your kids are screaming because they're hungry and you need to make something fast. So I would say start with I always start with the breakfast. They seem easy. They're very simple, but they're wholesome, and I think people struggle with breakfast a lot, just in general, because they don't know what to eat and they feel sluggish when they eat too much, and that sets you up for the whole day. So maybe start with the breakfast so that you have the energy to kind of continue on to other items, because if you start off the day tired with eating your toast and, just whatever you're putting on that toast, jelly, whatever, then you're just not going to be mindset wise wanting to do anything for lunch or dinner as well. Other people, I would say, for me, I started with the dinners because that's where I fast for 16 hours. So I don't really eat a breakfast, but the dinners are simple enough to kind of, hopefully my patients have told me that their kids enjoy it too, because it's not just about us, right? We're feeding a whole family. So the salads are easy to get to. I love the proteins, the seitan recipes are in here. People don't know too much about that. It's actually more of a grain than a protein, but it's loaded in protein. So, there's concepts in here that will take away from people needing to bake with butter and eggs. If you love to bake, maybe start with those recipes for the muffins. They're super easy and they actually taste really, really amazing. And I think the best compliment we had was I gave it to my kids and they didn't know that it wasn't real muffin. Because it didn't have the eggs and butter.
I absolutely love that they are delicious, easy to make, but they are really in line with what I was used to eating on a Western diet as well. Only they are packed with health. So I think a lot of times my patients complain that they, as you said, they can go to some fancy Asian shops or these new movement of buying things that you can't even pronounce to make it healthy. I love that you're using everyday ingredients, but in a healthful way.
Thank you. Yeah, we tried really hard to kind of keep it simple that way.
It's incredible. And what is your favorite recipe from here?
So I love the colorful ones. I love the one with the pomegranate. I love the beet and cabbage salad. These are just, cabbage is so healthy I'm very passionate about hormone health and cardiovascular. So cabbage and cruciferous vegetables are really good for managing hormone imbalance, and beets are really good for cardiovascular health. So some of these foods that we have, there's coleslaw in there that's also loaded with the cruciferous vegetables. The other thing that we like to include are things that are just not common, like palm salad. So hearts of palm, for example, it's a very good protein source. But for me, I have to keep remembering to use it in things, even though it's very, very, very valuable. It fills you up. It has a unique taste to it, but it's very easy to use. So we have a grape tomato and hearts of palm salad. So, I like the different ones that you're not seeing on a regular basis, but they're super easy to make. Which other ones are my favorites in here? Muffins, the muesli I like a lot because anybody can make it, your kids can make it. It's just very simple, but it's also not going to make you tired in a couple of hours, And then for a quick dinner, the seitan tacos I like because it's a different protein source, not just black beans or beans, which I'm usually using in my tacos. So those are kind of the ones that are my go-tos.
And for those who do start and want to get on with their health, when they start early with a high fiber diet, we know in the Western lifestyle, we eat about 10 to 18 grams of fiber maximum. And then when we go on a whole food plant-based diet and they really want to get started in cracking, is there anything that they should be worried about in the beginning or cautious on increasing their fiber intake?
Yeah, so a lot of times, remember where you start and what your microbiome is starting out with will sometimes make you not tolerate the fiber. I get a lot of patients that say, I can't eat fiber, it makes me bloat, it makes me feel uncomfortable. Well, that's because the gut bugs that you have are not the ones that actually can process fiber. They're not doing you a favor. They're not good. They're not effective bugs for you. So you want to start slowly. And instead of trying to get to maybe 10 grams extra a day, you start with 3 grams extra a day. Maybe a bowl of raspberries, maybe, something that has a green in it. Remember, greens also have fiber in it too. So you can start small and then work yourself up to A beans. So say black beans bother you. Maybe you try kidney beans. Maybe you try a different legume or sprouts, for example. They will be easier to digest in the beginning, which will create a different microbiome for you, which will help you tolerate things like beans and the other things. The other agent I use a lot are digestive aids. Digestive enzymes in the beginning to eat with your meals to help you digest your foods. There's vegetarian digestive enzymes out there. You can add lemon to use to anything that can help increase some acid to help you digest your food. Apple cider vinegar helps you digest sometimes. So experimenting with some of these things in addition to your food that you think are not tolerating, I would encourage people to keep trying by adding these things. I also use bitters. About 20 minutes before. Bitters are very commonly used in drinks, but you can use bitters on occasion also prior to your meal to help you digest that food that's coming. It helps contract the gallbladder. It helps digest your foods a little bit better. Just kind of experiment with those things.
Yeah, and just remember also to drink about 8 glasses of water. It's something that I have to remind myself on a busy day as well.
Yes, that's true. Yeah, makes everything efficient.
Absolutely. Thank you very much. Before we move on to our Zoom discussion, could I ask you just to summarize with 3 actionable takeaways for our listeners? How could they start with their health gain?
So if we're focused on overall lifestyle, I would say one of the big things is just create more periods of quiet. Create more periods of quiet, whether that's shutting off your notifications at night, turning off the lights, working on your sleep. During the day, maybe it's not listening to the news 5 times a day that's stressing you out, constant news feeds. Create periods of quiet. It doesn't always have to be that I have to meditate for 30 minutes. Just create more quiet, and then your brain will want you to meditate. You'll kind of move into that. I think that that period of quiet, along with things like adding times of not eating, because I feel like I used to be someone that said, eat breakfast and eat every 2 hours. But I found that in some patients, that's actually worsening their insulin resistance and things like that. So in addition to obviously high quality foods, being more mindful, having periods of quiet, meaning fasting, not eating for, say, at least 12 hours of the day. That sounds ridiculous, but if you think about it, if your last meal is at 6 and you eat breakfast at 6 a.m., that's 12 hours. But a lot of us are reaching for snacks at 10 o'clock. And you know why you're reaching for a snack? Because your body's tired and you just should go to sleep instead of eating. The other thing you can do when that happens is drink some water. So use fluids, low calorie fluids, herbal teas or water to replace that hunger craving that you're having. So creating quiet, being more mindful when you eat, and also maybe working towards periods of fasting. Those would be kind of the three things.
Brilliant, three pointers at the end. And of course, to buy the Body on Fire book, really, guys, really honestly, it's such an easy tool to integrate a healthy source of nutritious food. If our listeners would like to find you in America, can they reach you on your clinic on Zoom, or is it just for Americans?
No. So I have Facebook Live every 2 weeks that we do where we answer questions from whoever wants to ask a question. I have podcasts and webinars on my website, rawwellness.com. I'm a practitioner in Maryland. I have 2 offices, but we do see international patients. So it just depends on what people need. But so a lot of the things that we talk about are available for free on the website. Downloads. I'd encourage people to write questions for my Facebook Live, which happens every 2 weeks. I think this time it's going every 3 weeks because of vacations for people, but please, connect with us that way.
That's really useful. Thank you for all that free information. We are adding the links here on the Zoom as well as on YouTube in the comments. You can find these links. Thank you so much for joining us today, Dr. Rao.
Thank you. Okay.
It was incredible having you with us. For those who are new to our YouTube channel, please hit the subscribe button, say hello on our social media, on Instagram, Facebook, also on LinkedIn at Afternoon Tea with Docs, or check out our website, afternoonteawithdocs.com, where you can become a free member to join a community of like-minded people wanting to gain health. So thank you for everyone joining us live. We will go off to our Zoom session. We hope that you enjoyed it.